I'm not the house of cards that falls down easily. I'm strong enough to handle what you throw at me.
Welcome to Mental Health News Radio. I'm your host, Kristin Sunanta Walker. Just what are we going to discuss? The intimacy that is mental health. Let's continue to make it as comfortable as discussing brain health or heart health. This show has been on the air for several years and we have amazing co-hosts. And then we created a network of podcasters on mentalhealthnewsradionetwork.com, a place where every possible facet of mental well-being can be talked about openly. My show, after several hundred interviews, the format is this: intimate, deep, funny, touching, sometimes uncomfortable, but always vulnerable conversations with interesting people. The goal is to have you, our listening family, many of you who have become my good friends, feel as though you are listening in on private conversations. Thank you for tuning in and becoming part of this amazing journey with me, and now with our network of podcasters. Just knowing this podcast might be helping any of you realize you are not alone on this journey called being a human being makes doing this podcast worth every second.
After all we promised, we'd be cordial.
Hello, listeners. This is Kristin, and we are doing one of our mental health business shows, something that doesn't get talked about enough in the business of mental health is finances. So we're going to talk to two experts today, David Opelek and Neil Johnson. Gentlemen, thank you for coming on the show.
Great. Thanks, Kristin. Appreciate having us on today. I know a lot of challenges, and especially in light of COVID, on top of all the normal challenges that providers and families are having, dealing with a variety of mental health issues and crisis, and I'm sure even our family and many have been touched in various ways. So obviously paying for that and financing and dealing with it today with all the challenges makes it even more challenging. So happy to be on today and talking about that.
Absolutely. So can we start with Neil, and you tell our listeners a little bit about your background?
Yeah, appreciate it. Neil Johnson, managing partner, Lawrence Evans and Company. We're a boutique healthcare investment banking finance consulting firm based in Columbus, Ohio. My background more in the banking, finance, and had kind of moved through working in bond financing with hospitals, nursing homes, with a boutique organization, and ultimately MBA from the Ohio State University. Then had gotten into some other specialty finance in healthcare, and thought, healthcare is not going away in my career lifetime. It's ever changing, evolving as we know, and very complicated and different state rules and regulations, and figured I had some job security there, and continued on with another specialty lender as well, until ultimately had started the firm up with a colleague. So we work nationwide with a variety of different providers and service companies, and have been working throughout various behavioral health, mental substance abuse, inpatient, outpatient organizations as they evaluate strategic options, financing, as well as possibly even restructuring. So I appreciate having us on.
Absolutely. And Dave, how about you?
My name is Dave Opelek. I've been with Lawrence Evans for a few years. I handle the debt and really the secured debt and real estate side of the practice. I've been in real estate finance for over 20 years, largely with some larger players in the industry. Red Capital Group, which is now part of Oryx, spent some time with Love Funding recently, as well as way back in the day with Bank One Capital Markets.
Great.
Yeah, thanks. I do a lot of skilled nursing, assisted living, hospitals, healthcare, real estate. My background is I'm an attorney by training. I'm actually in grad school doing my MBA at Ohio State as well.
Okay. both busy men. How have you personally been handling, this isolation piece of COVID?
Well, for speaking for myself only, um, it's not really, our firm is very nimble, and fortunately, we've been able to really just keep going. We've, utilizing Zoom as just like everybody else,
Right.
but we've got our team is very flexible and very independent at the same time. So we've not really been hit too hard with that. From a firm perspective, from a personal perspective, I have 3 young children, and it's been a little bit more challenging on that front.
Yes, business meetings at home with 3 kids is going to be definitely challenging. How about you, Neil?
Well, I think a little different place in life, and with a couple, 4 stepchildren, one being in New York as a musician that mom tried to get home, and he ultimately wanted to stay, and so kind of locked down there now, unemployed, trying to deal with that, a little more isolated, and so being in Columbus, even though Ohio was one of the earlier ones to with the governor. DeWine making some big decisions to shut the state down. Hindsight had been pretty smart and slowing the progress down. And so trying to deal with that. Had a father-in-law that was ill and living with us and on the hospice and had passed away the first of the year. And so just dealing then with the wife, the loss of a parent, always challenging. But looking back, I also had some other family friends recently pass away, and very challenging during these times, especially with those loved ones in nursing homes or hospitals where you can't visit.
Yeah.
So we were kind of looking back, going, it was kind of a blessing that first of the year we didn't have to deal with that loss of connection, and so feel for all those out there that are dealing with that issue. And so the isolation, just trying to stay disciplined, try to get some exercise, out for walks. Trying not to eat too far out of line, and so I think it's just the discipline of trying to stay focused and busy and connected through, whether it's Facebooks or games or others. I think today it's much easier to do that in the past. So
Right.
and business, to build relationships, to conferences, to meet people, go visit. Not doing that, not traveling. It can be hard to get out there and make those connections and help solve the problems.
That's what's been interesting. I'm glad you brought up the conference piece. I mean, I cut my teeth on doing my show by being at like National Council for Behavioral Health or National Conference on Addiction Disorders, or it goes on and on and on, the number of conferences that I've been to, and did my shows from there, and was also speaking at conferences. And I don't like to do them so much anymore. Just that was when I was just doing my podcast, but with the network, it's not, I don't have the time to go do that like I did, but I still had a few that I was booked to be at this year. And what was interesting was realizing, oh boy, these venues really count financially on those conferences. And those conferences aren't happening. The
Yeah.
economic hit of uh, already paying out so much money for the venue and not having it, and then B, of not having it, which means the funding that they counted on coming in, after being there. I mean, there are businesses that rely on these conferences. It's not just that too. It's businesses in mental health, let's say a consulting firm that, is always at National Council's conference every year, and they get 80% of their business from that particular conference, and that not happening until next year. I guess what I try to explain to people is this isn't just restaurants and clothing stores, for example, that are having issues. There are all these other ways that we're impacted financially. The scope of it is just enormous.
So my wife thinks that going to Florida or Las Vegas, Chicago for a conference, I'm having fun, but it's really busy from 8 a.m. until 8 p.m. or later with meetings and dinners and events and building those relationships, and really a full day, and spending some of the money out there in the cities and different vendors. And so obviously I feel bad for those that rely on that and rely on building those relationships.
Some of us won't even see the impact that the loss of those or the temporary loss of those are going to have, because there will be this trickle down effect that will happen later, that will hit some of us later.
Yeah, and that kind of leads maybe into, really where the economy is today.
Yeah.
And I think we're in a little bit of the government has really put in a lot of money and acted quickly. And I think everyone's thankful for that. But with the extra money for unemployment, as well as, obviously getting the checks out to individuals, like even my stepson in New York, who's unemployed, and really didn't qualify in the new gig economy. There's some new programs out there to help those qualify. So thank goodness he's able to pick up some of those. And so what happens maybe, later this year, as a lot of the providers we work with are receiving checks, advances, the PPP program, which Dave touched on, that ultimately maybe will turn into a grant and you will not have to repay. As we kind of sit closed or reduced services, and obviously looking at maybe telemedicine or other ways to help your patients. But really, where are we right now? But I think the concern is later this year or maybe even into next year, when that kind of hangover of all this government stimulus money starts wearing off.
Right.
And where's unemployment, which is today over 20%? Where will that be? Will the jobs come back? Will the economy be sustainable? And will we need additional funding?
Right.
Which there,
Neil and I were talking about yesterday at the office. I think that it's the stimulus money is really masking the underlying problem, right? I mean, there's a huge pool of folks that are no longer employed. They've not only just lost their jobs, they've lost their health insurance, they've lost their 401k benefits, they've lost basically every means of earning income until they can take that time, find new jobs. And once the economy opens up again, there's going to be a lag there, whether it's October, November, whether it's December, February. It's coming. I don't think anybody's quite sure of when it's going to hit, but there is going to be a situation where the government aid slows down and or stops. And I think there are a tremendous number of people that are going to be caught in the middle of that.
and Kristin, these are professionals too. It's not the chef or the server at the bar. I mean, there are lawyers and bankers, and I think even certain selective physicians, obviously the elective ones, are sitting on the sidelines waiting for the states to reopen for the dental or
Yeah.
orthopedic surgeon. But ultimately, from a practice side, these professionals too are trying to figure out what to do and how to sustain their business and their quality of life.
Well, I mean, what do you do as a practice owner? You have staff. You've got, depending on your position, you've got nurses, you've got billing people, and you've got receptionists, and what do you do with all of those people? You can furlough them, as opposed to maybe laying them off. But the other side of that coin is, you need to make sure we have enough liquidity in the practice in order to restart the whole thing.
Exactly. That's the piece. And mental health has not been the high revenue sector of healthcare. So there are practices that are, let's say, home health agencies as an example, where their margins are their staff makes $9, $10 an hour, and they can only bill $12 an hour. So there is no room to have any kind of surplus.
Yeah, and that's, we have seen that. I think it is more pronounced in the behavioral health arena. But we're starting to see that across the spectrum. any sort of skilled positions in rural health in particular are just being squeezed.
Yeah, and can we talk, some shop things like interest rates, lending status, all those things that
Those good fun topics.
yeah, those
I-
good fun, ha ha, but necessary, especially right now. Listen, people wouldn't maybe want to have listened to this in November of last year. Oh, what a boring show! And now people are like, please give me this information.
So, well, there's a few things we should probably talk about in terms of, rates. On the face of it, actually rates look great. The U.S. prime rate today is at 3.25. A year ago that was 5.5. So from that perspective, you think things are looking pretty solid. You look at things like the LIBOR rates, what we base floating rates on, or the 10-year Treasury, which is what most mortgages are based on. The 10-year Treasury is at 70 basis points, which is incredibly low. The 1-month LIBOR is at 17% or 0.17%, 17 basis points. So these are both just for reference are incredibly low rates. The issue, though, is that because of the economic uncertainty surrounding COVID-19 and the opening up of the economy, and not, most places don't have a concrete plan as to what that's going to look like. It's been sort of haphazard. What we're seeing is a lot of credit officers are being very, very conservative about who and how they're lending right now. And so trying to, folks looking for working capital right now, that capital we talked about for opening up their business and rehiring their staff and getting things going, it's been a challenge. I think we've had a few clients that we're working with that are solid providers that have a history that really they need 60 to 70 days cash to get everything back up and running and allow their billing cycle to kind of flow through the system and get their reimbursements coming back in. And lenders have been very reluctant to provide that capital.
Understandable, yeah, why they have been, but also I'm seeing, organizations that just didn't really want to jump on, say, telehealth. And now they have to, and yet they don't have anything in place to do so, and they don't have money coming in, and and so it's not that they can't have cash flow coming back in. It's like they don't have the cash flow to invest.
Yes.
You know where I'm going with that.
Yep. Well, interestingly, we actually just had a client that we were working with that came to us and was looking to invest in a number of pieces of the telehealth puzzle in terms of, they needed better equipment, they needed some upgrades to their EMR, they needed some other pieces, and we were able to secure for them a sale leaseback on the equipment side of things. And that option for many practices is probably the best way to go right now, because it doesn't encumber the rest of the practice. It doesn't, you can get around any other lending restrictions if you structure it as an expense, right? It's not a mortgage. You're basically, selling you're buying the product ostensibly and then selling it back and leasing it back from the finance provider. The mechanics of it are a little bit complicated, but the result is you can usually get a fairly decent financing structure out of something like that for hardware investments in telehealth. For rural providers, also has a program it's a competitive program, but it offers up to $1 million for rural providers as well to provide, to invest in that telehealth technology. Not just, all of the diagnostic equipment as well, not just the video screens and the telephone electronic components, but also the blood pressure monitors and the, all of the other associated equipment that goes with it.
And obviously any, beds or computers, but even software, some of the intangibles. And if you purchased it in the last 6 months, possibly a year with cash, you could go back and finance that maybe back out. And especially today, we've always been working with clients to make sure that they're managing their cash flow, essentially hoarding cash, because the uncertainty right now. It's better to have cash and get your lines of credit, get the cash from the lines of credit, and be conservative on what that outlook is going to be in the next 6 months to a year. And we see the hospitals still laying off right now, where you'd expect they'd be busy. Well, as they're evaluating different parts of the organization and being efficient. And so, cash is king.
Yeah, exactly. Getting access to it and where to go is really, more of one of the major issues. So can you talk a little bit about, what exactly is available and where the heck you go to find it?
Well, I think the first place that practice leaders need to go, if you haven't already done it, apply for a PPP loan, the payroll protection program. It provides payroll coverage for existing employees. It's available through basically most commercial community banks are going crazy with this. There's still some money left over from the first two rounds that were done. So it was at the end of April and early May. There's still the second round still has some funding available. We strongly recommend, if you haven't done it already, go ahead and apply for that. There's a number of criteria that are that you need to meet, but they're not. It's not ostentatious. It's not onerous. It's a pretty simple process to apply for it, and as well as if you don't plan on laying off a bunch of folks, you have until the end of June, even if you have already laid them off, to rehire them. And it doesn't have to be. It's a numbers count. It doesn't have to be the exact same individual. You just have to maintain the same payroll numbers, right? The FTE count.
Right.
And so that program is one of the easier ones to get some quick cash from. It allows you to make that payroll, that biweekly payroll deposit, and it makes everybody feel a little bit better. As well as Neil mentioned earlier, it is a loan, but it can turn into a grant provided you meet the rehiring requirements, and then to the extent that you don't meet them, it's prorated. So even if you do your best and I'm still laying off 3 people, fine. They prorate the amount that you've borrowed against what you've the proportion of the requirements that you've met, and so it's kind of a weighted average result, and it's not an all or nothing thing, which is also a nice feature.
How about how does that apply, or does it apply to gig workers? And when I say that, I mean, let's say it's, as there are many, it's a behavioral health services organization. Everybody is a 1099 person, and they're all technically out of work.
Well, unfortunately, the PPP doesn't adequately address the 1099 situation. It does not include so if you're a business owner and you have a number of 1099 employees, and I use the term employees, we call them independent contractors, it does not cover them. Now, those independent contractors can and should apply. They are eligible if it's Dr. Bob LLC as an independent contractor for Community Health System Inc. can go out and apply on his own for for relief under the PPP. He's completely eligible for that. Now, that said, it gets a little more complicated, and I don't want to get into too many individual circumstances here, because there's a whole host of requirements that independent contractors have to meet. But if you can prove the last year's income and can substantiate that with your tax forms and all the required documentation, the process really isn't overly onerous.
Right. And that means that each one of those people, being independent contractors, can apply themselves. So yeah, gotcha. Well, let's talk about loan forgiveness, and people don't really understand what that means. Are there gotchas that we should be aware of with that?
Yeah, they're well, they're largely it's fairly straightforward. I mean, the short of it is that if you don't reduce staff, most if not all of your PPP borrowings will be forgiven. That's the short of it. Now, there are some nuances depending on the size of your organization and what, how the total value of your payroll post COVID ends up looking like. As a general rule, they're really, all of the forgiveness rules haven't been promulgated yet. So, don't, if this comes out, if you're listening to this 3 months after we've recorded this, don't hold my feet to the fire.
Right. I've been telling the listeners, so this is being recorded on May 27th of 2020, just so you know where we were at the time that we were talking about this.
Thank you. And again, I think that the idea here is, as long as you can substantiate that your payroll numbers and the number of FTEs are essentially the same as what you've reported to them prior in your loan application, it should work out in your favor. And again, I hope, and it's my hope that the government doesn't come out and convolute this any more than they absolutely have to. But the guidance that we've received so far has really indicated that the idea here is not to pull a gotcha, right? But is to really, the idea here is to make, if you hold up your end of the bargain, we're going to forgive. We'll forgive it, the bulk, if not all of it. And so that seems to be everything we're hearing from SBA and from the government is leaning in that direction.
We've had some clients speak to more than one bank, and that's fine to speak to more than one bank about getting the loan. But once you get it, then you need to notify the other banks and either pay it back, as we've had a client get multiple loans, and they're different amounts. So
Right.
Each bank's maybe looking at it differently. And so what happens when they get audited in the future, and what is forgiven and what's not? The other thing is the tax consequences. Ultimately there's going to be, income and expense offsetting on this loan that you'll need to speak with your accountant and tax attorney on.
Right.
It's changed a little bit.
Right. It's been very interesting. I won't go into how it's been interesting for me, but it's definitely been interesting. Can we talk about, issues with taking the funding?
Sure. I think, well, the PPP loans are kind of the easy ones, right? There aren't that many strings on them.
Right.
Again, it needs to be used to pay payroll and to, pay employee associated costs, whether it's health insurance or, you can include in most cases the employer match on 401k and retirement savings, all of that stuff. As long as you can show that that's where the money ostensibly went, there really isn't a lot of issue there. And the funds typically are deposited, within once the banks receive approval. We've seen turnaround times from application to funds on deposit of about 48 hours. So if you have all the information, you can submit it to your bank. I mean, we've seen these guys turn this stuff around incredibly quickly.
Yeah, I have seen that too. It's like I said, it's been very, very interesting. But I'll tell you what, I mean, I think we all have to pay our taxes on June 15th. Is the new
Yes.
And
July.
Or, oh, sorry. Oh, is it July?
You could pay early, but July.
Oh, it's July 15th?
That's why I thought everything was bumped to July as well.
Oh, okay. Well, thank you so much for telling me that, because I did not know. Though the day after that date is when all the creditors are going to start calling you, including the IRS. So just be aware of that, people. And you may not have recovered yet, and you probably haven't recovered yet, but those phone calls going to come.
And so the next thought is, what do we do now? And there's also another government program that's come out and maybe starting to see a little bit of it. It's the Main Street Lending Program.
Mm.
It's similar to like an SBA program, but it's based on 2019 profits. And so your profits from 2019 will essentially establish what you can borrow. Now, this is a loan, it needs to be paid back, and there's a repayment that is fairly steep, beginning, I believe, year 2 with 15%, year 3, 15%, and then the remainder, 70%, year 2 and year 4. And again, this is a loan working with a bank, but it can help you ramp up operations and fund the business. Now, you cannot use the funds to pay off existing debt. So if you have a bank line of credit or other financing in place, you cannot use the money to pay that off.
Right.
Now, you can still maybe borrow the additional money. And so again, using it as a tool for the working capital to ramp up.
But the pieces of that, this isn't as automatic as the PPP. This requires there's some shared liability between the bank and the SBA, or in this case, the Treasury, and so the banks are taking a bit more of a closer look on how these things are underwritten, what the likelihood of repayment is. And, they're really the takeout in year 4 with that balloon payment, it really is going to be a question of, does the bank have faith in the fact that you can ramp, in 4 years, you can ramp your operations up to a level that will allow you to refinance that 70%,
Right.
In year 4. And, as things move along here and we get a little more, clarity around how this is going to work exactly. And I think, we got some guidance at the end of April. I think that we're expecting some guidance here early June as to, really what we can expect on this. The banks will start marketing this a lot more, but as a practitioner and somebody who's, looking for, capital from these programs, really think very carefully about what your revenue stream looks like in the next 4 years, given where we are and what we're coming out of, and model appropriately, because I do think this one does have some gotchas to it. That the payback period is short and it's steep. The price, the rates we're looking at things like, as we talked about LIBOR, it's LIBOR plus 300, which, right now, as I mentioned, the LIBOR rates are at historic lows. 1 month LIBOR is at 17 basis points. So that's, it's a 3.17%, floating rate loan that, is a lot of it is interest deferred. And once it starts paying, it's going to be very aggressive. So just as folks are hearing about this stuff, keep those terms in mind, because that is kind of a gotcha moment for a lot of people.
It is very, very attractive rate and potentially in a second position behind an existing bank. Now there is a minimum, I believe it's 500,000 is the minimum amount, and so you really need to have generated at least 100. Possibly 100,000 in profits in 2019 to qualify then and taking $500,000. And so, larger providers and groups that, would need to take that. And I think smaller operators, there's several other private options that might be available, or other techniques to help manage your cash flow this year.
I'll tell you, the reason why I asked about issues with taking the funding is because we're such bleeding hearts in mental health. I actually have had some agencies that are struggling, but they're making it, but they're struggling, and they got a loan, and then they go, well, I don't think we should take it because there are people that are in more need than we are. And I say, I love you. That's why I love this field, but take the freaking money.
Yeah, Yeah, we run into that from time to time, and it's one of those conversations you love and hate to have with your client, because
Yes.
you have to, on one hand, I love clients that are like that, who really genuinely care about. It's not just a business to them, right? They care about their community. They don't want to be taking funds from other folks or other organizations that could really use them. But in this case, right now, that's who these that's what these programs that we're talking about are targeted for. They're targeted toward, small and medium-sized businesses that are struggling. And, even if you're, and I kind of hate to say this, but even if you're not struggling, but you can see 6 months down the road where we're going to have issues, take the money, like take it and run.
That is, I know, I have thought about this myself. I mean, I live a very modest life. I went from technology consulting, which I still do, but not at the rate I used to, because this network is massive now. But I live a purposely modest life so I can really do an advocacy platform. And I was like, well, I'm not going to apply for a loan because I can make it no matter what. And I'll tell you what I did, because there are what I'm using it for? I'm using it to grant people shows on the network that they otherwise would have to pay for, who have no money to be able to do it, but they need to be able to use their voice. So I've also personally loaned people, money to people that really, really need it. So in that way, I'm thinking that is me helping the economy. And in order to do that, I need to make sure that I'm okay financially. So I'm taking the loan.
Well, as the saying goes, banks will loan you money when you don't need it. And so when
Right.
you can borrow, it's always prudent maybe to get that line of credit or have the availability, and just keep that modest, prudent, disciplined approach that you can then always pay it back.
Right.
It's very important then to have that liquidity, use it appropriately. And like anything, it's just, don't go buy a house that you can't afford
Oh, right.
and take on
Exactly.
that mortgage. The
Right.
same concept with it.
And Neil brings
I
up.
downsized again at the time that this happened. I do this so well. I don't know how I figure it out, but I did it during the actual, the recession in previous years. I knew ahead of time because I could see what was going on with my clients, and I made us move 3 times, downsizing by half each time. And so I did
God
that.
bless your family.
Yeah.
Yeah, I did that again with this, because I was like, this, I don't know. And so I cut my expenses again in half, and I'm okay with it. I love what I do so much. I literally don't care if I got to eat ramen to do, you know what I mean, to do it.
That's
And
commitment.
I'm also happy to not eat ramen and do it too, either way. Well, gentlemen, what can we close this out with as some hope and some last thoughts?
I think know and understand all of the options available to you, government programs, non-government programs. Banks are definitely concerned and tightening up. There's a lot of non-bank options available that understand healthcare, that understand, the mental behavioral health businesses. There's also, you may have seen the merchant cash advance cash flow loans. There's some good providers and some kind of questionable that can get caught in. They could be used as a tool, but just be careful on that. And it's like corporate credit card; they're not cheap. Don't be afraid to pay 12%, 15%. I think kind of above that, definitely. Proceed with caution. Use your vendors. A lot of times work with them. We're seeing the big hospitals are going to their vendors saying, hey, take a 20% cut. We have a contract, but take a 20% cut. Reduce our payments, push them out, term them out. Even the IRS, you can use from right now your portions of your payroll tax amounts. You can push out for repayments next year. So again, review all of your vendors, look at your cash flow. When we talk about a 13-week cash flow, which is kind of the industry standard out, really 3 months, and model out, what you expect your payments in and your expenses, so that you can understand where your business is. And a lot of organizations that they have a feeling of what it is, but they they don't really know on a week to week. And so during these times, to really understand that and give you a better peace of mind to know how to make payroll a month from now,
Right.
which then goes back to the, you want to make sure you sleep at night, have that line of credit, get the government.
Yeah.
The donations are not coming in like on the different programs, questions, not having the events. And so, a lot of organizations, nonprofits that are expecting those, you need to start planning now, because it's going to be a down year.
Yeah, exactly.
So be prepared. I was a Boy Scout, be prepared, and you got to start thinking about all these things.
Well, that's why you're in finance, and the rest of us are like, we don't know what to do because you know about pre-planning. Yeah, it's better late than never, people. I'm telling you, listeners, it is better late than never. Even if if you don't put yourself in a position where you're like, hey, you know what, I've already not pre-planned for however many years of my life, there's no reason to start now. That is baloney. You can start now. Gentlemen, thank you so much for coming on the show. Where would listeners find more information about you, figure out how to work with you, if they qualify to work with you? Where would they go?
LawrenceEvans.com, LAWRENCE, another E, VANS.com. Again, Neil Johnson, managing partner, based in Columbus, Ohio, but we're working nationally and even a little bit internationally as well.
Absolutely. And Dave Opelek, both of you, Neil, Dave, thank you so much for agreeing to come on the show and giving us some sage advice.
Thanks, Kristin. It's been a lot of fun.
Absolutely. Listeners, thank you so much for tuning in to our Mental Health Business series on my show, Mental Health News Radio.
Hi, listeners. I'll make it quick. These are some really cool places that give discounts and other cool things for listeners of Mental Health News Radio Network. If you want to get amazing help with healing from narcissistic abuse, go to healfromanarcissist.com. If you want CBD products that are the best of the best, I use them myself, go to proze.com and use the code mentalhealth20, mentalhealth20. If you want to get daily perk ups that help retrain your brain to think more positively, go to perkupdaily.com. And also, just because this one's fun, snarkycandles.com. I guarantee you'll love them. Snarky with a Y, SNARKY, candles.com. And don't forget, if you want to hear all the shows on the network about first responders, you can go to firstrespondermentalhealthnetwork.com, and all of our shows that focus on narcissistic abuse, narcissisticabusehealingnetwork.com. Thanks for listening, and back to the show.
Sometimes I'm passive aggressive, but never without good intentions. I heat up and act on my emotions.
Thanks so much for listening to Mental Health News Radio. Our podcast can be found on iTunes, Stitcher, and hundreds of other podcast apps, or you can visit our website at mentalhealthnewsradio.com. If you have a question or would like to be a guest, become a podcaster on our network, or join the amazing organizations that help keep us on the air, please email us at info@mhnrnetwork.com. Get ready for that special goodbye from our resident therapy dog, Miles, and a special thanks to Emily Sohn for letting us use her incredible song, Cordial, for our podcast music. Listen to the full song on SoundCloud at emily.sonne.
Don't be surprised when I don't hate on you.